Trauma care is a really unique term, particularly in orthopedics. I think many people at Ohio State assume if they're being taken care of by a traumatologist that they were a trauma, that they were a motorcycle accident, in a car accident. But trauma really is a unique spectrum. We take care of very simple, almost low energy traumas where we have an older person just slip out of their seat at home and they fall and they hit their head, they break their hip. While at first glance, it may not seem like a trauma. Sometimes these are the sickest patients. Sometimes it's a symptom of much bigger things going on. So they enter into our healthcare pathway as a quote unquote trauma, but it's an opportunity to optimize them physically, to overcome some of the other medical challenges that were maybe not made aware before. I think people think trauma is a big scheme of things, but we also take care of straightforward fractures. When people break a bone, and the misconception is a broken bone is different from a fracture, but in real terms, it's actually exactly the same thing. Helping people understand the definitions and the medical jargon that we use is also unique, I think, to trauma. We often use a lot of jargon in medicine, and as a trauma patient, you may have many, many medical team members taking care of you. And one of my favorite things to do in the trauma world is to explain what the care coordination looks like. They may have a traumatologist, an orthopedist, a plastic surgeon, a medicine doctor following them, and really helping people understand the unique team environment that goes with trauma care. If you're one of our trauma patients, even if you weren't a true trauma in what most people would assume, you're often getting a very multidisciplinary coordinated care experience. What's really unique about taking care of trauma patients is you often meet people at a really sensitive time in their lives. It's a journey, it's a shock to the system, it's a shock to the family, and really it's a time where you feel like you have an opportunity to make impact. And sometimes the outcomes aren't what we hope, and it's helping the entire family, the neighbors, the friends, the family come to terms with the next steps. It's also extremely exciting to see the unique changes that can happen over the course of a trauma journey. You see unique bonds grow. Family members who weren't talking in these times of trauma often bridge gaps and overcome many barriers that they've had in their personal lives. When it comes to the really scary end-of-life decisions, family members really do uniquely come together, and so does the community. And I think that's what I love most about doing trauma care.